for those of you who don't know, Chris had his hip replacement, so he's doing post-surgery treatments for a hip replacement. And boy, after the surgery, doesn't the hip feel better? Like you have the pain of the surgery, but that pain like deep in that socket is gone. Yeah.
Oh yes, most definitely. As soon as I could stand up, even still feeling groggy and under the anesthesia, that nagging pain in the groin area
is gone,
completely gone.
Right.
Yes.
Yeah. Good for you. Good for you. So once the wound is closed up, start taking the helichrysum rollerball and rubbing it on the incision site, like right on the line itself, and then a little bit around it. And it's pretty strong helichrysum, but it's got some jojoba in it. It's about 4 mils of helichrysum and 6 mils of the jojoba. And so you're getting pretty potent, but should be very soothing to the skin. And the idea is, for one, it will help reduce inflammation and reduce some pain, but you're reducing the scarring that's in and around that area, which is really not so much about the incision site, but you're dealing with what you would call a fascial lesion, which is like a knot, but in soft tissue rather than in a muscle. Right, what most people call scar tissue is actually a fascial lesion, which is like a type of knot, but in the soft tissue. And so by going through and putting helichrysum on that, it helps to reduce the inflammation, and it helps increase and improve the circulation to that fascial lesion. And the way that you release that kind of scar tissue or a fascial lesion is you basically hydrate it. You hydrate it with blood. Right. And so by taking out that spasm and that tension, allows more blood to penetrate that area and breaks down the scar tissue quite substantially. If you don't do something like that, what they are going to do in, probably 4 or 6 weeks or something, is they would have you in physical therapy, and they will do like some friction massage, which, they go against the incision site, and they rub kind of back and forth kind of vigorously to what they would say is like break up the scar tissue, but you're irritating it to get blood in the area, so that blood starts to penetrate the scarring. And so there's been many cases where we went through and we applied the helichrysum after the incision closed up, and when they would go into physical therapy, they'd go, yeah, you don't even need the friction massage. The effects are pretty consistent. I mean, there's been a couple of times where it didn't completely treat it, but I think there's like other factors involved other than just the local site, and the person already had some fascial issues in other parts of their body, and so that's probably the case there. But I mean, I'd say 90% of the time, the helichrysum just knocks that scar out like nobody's business, and it's not something that's like an ongoing thing. It's usually by the time that bottle's done, your scar issue is done. Every once in a while, you need to do a second bottle, and sometimes you end up doing a second bottle just because it feels good on the scar site. Because the other issue is that because of the incision, you'll have a little bit of pain as time goes by when there's changes in the barometric pressure, or like if you get cold, like that area will ache a little bit. But if you keep treating it with the helichrysum, even that goes away. Like that will just stop being an issue at some point. And so the helichrysum is meant for freeing up that fascial lesion and reducing the scar tissue, and the incision site itself. It will take out the thickening, like and if you have a tendency for keloiding, like where it gets thick, it will actually even thin that down. I mean, I've used it on people where the scar was 20 years old. We put it on there, on a daily basis, and the keloid actually started going away. And so like almost immediately, like within a few days of treatment. And so You know, you use that bottle up, even if it feels good, keep using it up because you want to rehab that site. And then the Blue Healer is basically super anti-inflammatory and super soothing to the sensory nerves. You know, it's very, very anti-inflammatory. Like you can see, it's a super dark blue oil floating around. So the solution that it's in is you know, that makes it a body tonic is witch hazel. So and it's pure witch hazel. There's no alcohol, there's no anything. It's just pure witch hazel. So shake it up really good, and then, you know, put a little bit in your hand and then rub it all over the area. And again, that's going to be very, very soothing. It's going to be anti-inflammatory. You know, usually within about 60 to 90 days, about 80% of the inflammation is reduced after a surgery site, but that last 20% sometimes takes 9-10 months, you know. So you want to just keep hitting the anti-inflammatory component of that. And the thing that happens after a surgery usually is that, you know, you come out of the surgery and the site feels okay, and then about a week to 10 days into it, the body starts waking up in that area, the nerves start waking up, and the pain can get a little bit worse for a little bit, you know. And so, you know, they're very good about giving you meds to stay in front of the pain intensity. But, you know, as soon as your meds start to wear off, that pain starts to kind of sink in. And so the Blue Healer, the reason why I gave you the Blue Healer was, for one, anti-inflammatory, calms down the sensory nerves, will help augment the pain meds, whatever they have you on. It helps to, you know, keep the pain, the edge of the pain down, and keep it from spiking too much. But that period of rebound, like when everything starts to wake up, if you apply it on a daily basis, it will knock that down, I find, quite substantially. You know, there's been times where it was so, but it makes it pretty bearable. And so, you know, you're just trying to weather a storm there. You know, after a few days or a week, it kind of goes away, but you do have that kind of rebound effect. And so there was that component. And remind me, I can't remember, what was the last thing? Oh, vetiver.
It was vetiver ointment, yes.
Right. So the reason for the vetiver, very soothing to the body. It you know, it has muscle relaxing properties to it. And when you're dealing with like a surgery site, you know, you're dealing also with muscles that muscles balance each other. And so there's muscles that work with each other, and then there's muscles that work against each other. And so when you have this surgery site, you know, sometimes what happens is there's going to be certain muscles that have lost tone that are going to throw the muscles that oppose them into like sort of a spasm, right? And so the vetiver is very, very relaxing. But the thing that you know, I don't know how much we've talked about this in the past, but part of the thing with vetiver is it's actually quite good in stimulating the immune response. Like, it's very good for strengthening your immunity. It's very relaxing to the body and can diminish cortisol levels in the body somewhat. It calms down the sensory nerves as they fire and go into the brain. But one of the other things that vetiver is very good for is it calms down a hyperreactive immune system. And, you know, normally you would say hyperreactive in the vein of like an autoimmune disorder, but here you don't have an autoimmune disorder, but you've had a situation where it was bone on bone or real close to being bone on bone. But usually when they're doing the surgery, it's bone on bone. And so there's been a lot of inflammation over a period of time, and the body just gets wound up in this inflammatory response. And it's almost like it doesn't have to like think it out. It almost just starts going there almost immediately. And so even though you've had the surgery and everything, sometimes the body is still a little bit in that process a little bit. And so I would actually rub that on your abdomen in the low back area. You don't even have to rub it on the site itself, but it will soothe that inflammatory response while stimulating the immune system and help the lymph move through the internal organs so that your lymphatic system doesn't get stuck in the gut, which happens a lot with the hip issue. And so it's a way just to kind of keep the body relaxed, keep the immune system functioning, keep the immune system regulated, and it's just soothing to the body. Yeah.
Okay. With the helichrysum, the roll-on, do you have a maximum number of times a day that should be applied once I can start applying it?
You can go crazy with it.
Okay.
Yeah. I mean, if it feels good and it takes down some of the pain, you want to do it 8 times a day, you could. I mean, usually people will do it once or twice, but that first couple of weeks, you might not be too active and you're laying there, and I say knock it out, because the more that you reduce that fascial lesion, the less the pain is. Like when you get up and start moving, some of the pain is the surgery site itself, but some of it is actually from that fascial lesion. And so if you can reduce that fascial lesion and you're getting up and you're starting to increase your mobility and you're starting to increase the distances that you're walking and things like that, the more that's unwound, the easier that stuff becomes. And the other thing is, when you're taking the black cumin internally, it's reducing inflammation, it's stimulating lymphatic movement, but it also is breaking down some of the scar tissue, but from the inside out. So you kind of have like this double approach to breaking down that scar tissue. So it usually makes you be able to be more active quicker than normal. What has been reported back to me several times was that we'd put people on variations of this like little protocol for the hip replacement, and the doctor would get concerned because the person was walking much further than was the standard, and they were afraid that they were overdoing it. But the person's like, I don't hurt. Like, I don't hurt, like, to make you stop. And so, yeah, like it makes mobility much easier when the time comes.